Recording. And are we live? I'm gonna see we're live. And I believe we're live. I'm just going to quickly confirm that fact. But thank you to everybody who is tuning in this evening. My name is Jonathan Cohn. I'm the Issues Committee Chair for Progressive Massachusetts, and I'm delighted to have with me today Rebecca Wood from MassCare. When we were thinking about what are some important issues that we could talk about in the kind of moment in which we are right now with a pandemic and a looming second Great Depression, healthcare and health insurance seemed like perhaps the perfect topic to talk about, as well as how messed up the U.S. healthcare system is. So, one, thank you so much for joining us, Rebecca. And can you tell us a little bit about yourself and what MassCare does?
Thank you for having me. So where did you want me to begin with my story? Because it's quite a long one.
You can give us, let's say, maybe the slightly abridged version of your healthcare story and why you got involved in single payer advocacy.
Okay, so my daughter Charlie was born at 26 weeks gestation, and she weighed 1 pound, 12 ounces at her birth. I had severe early onset preeclampsia, and there was no choice other than to deliver her. And I learned very quickly from that experience, there's no such thing as good insurance. Over the course of the first 3 or 4 years of her life, the healthcare system bled us dry with copays, deductibles, exclusions, automatic denials, you name it, they found a way to charge us. And so eventually I found myself having to make a choice between my healthcare and hers. And at first it was my asthma inhalers that I figured I can do without. I'll just cough and gasp for air. Probably not the most prudent choice, but it was one I had to make. And then later on, I cracked a tooth, and it was right around the gum line, so I needed a root canal and a crown. And I decided to put off having the root canal and crown by one pay period in order to pay for her healthcare costs. And in doing that, I ended up getting a massive infection throughout my mouth and jaw. And the swelling cut off my airway, and I had to go to the emergency room and receive IV antibiotics. And then afterwards, they said, go to the dentist, you're gonna have some teeth pulled. So I went, and in hindsight, when I think about it, I think maybe I could have argued with health insurance that it was medical rather than dental, but that would have taken days, and I needed those teeth, the tooth pulled. So I went, and in 6.5 hours, I had all of my teeth pulled and parts of my jaw scraped away under local anesthesia. But this isn't actually when I became Medicare for all. Surprisingly enough, I just thought this is how our healthcare system works. So a few years later, when the ACA was under attack, Charlie's birth was a pre-existing condition. And so I had no choice other than to go to Capitol Hill and fight to protect her health care. I mean, at that point, I'd given up home ownership. I'd given up going to grad school. I'd given up my jaw and, all of my teeth and parts of my jaw. There's no way bad policy was going to take her future from her. Mm-hmm. So we went up there and fought, and as I saw how things worked, I realized what had happened to me wasn't just how the healthcare system works. It was a policy failure. And by the time McCain did his thumbs down, I realized I wanted to work on Medicare for all. And so I spoke at Bernie Sanders' 2017 bill introduction, and I testified in front of Congress last June. And now I live in Massachusetts, and I'm an organizer for MassCare. So here I am.
Welcome to Massachusetts.
And you said, what does MassCare do? Well, we are the single payer campaign in Massachusetts. We work on both the state bill and the national bill, and we are trying to get Medicare for all passed.
Nice. I think the mention of the Affordable Care Act is a great segue. So one thing And as well as with Massachusetts, where the healthcare reform bill that Massachusetts passed back in the first decade of the century was kind of a model for the federal legislation, which just turned 10 last month. And I'm curious to hear, and as somebody who's been involved with advocacy around this, what do you think that they did well? Because there were improvements in the status quo ante, but importantly, what did they leave out?
Wow. So first of all, what they did well was they covered pre-existing conditions. Mm-hmm. Without that, Charlie never would have been insurable. Her birth is a pre-existing condition. Something else they did well was they got rid of lifetime caps. Charlie was in the neonatal intensive care unit for 3 months, and she would have exceeded her lifetime cap before she came home. I actually call her sometimes my $1 million baby. So they did well with that, and I'm forever grateful because Charlie is an example of what's possible when people have access to healthcare. Their shortcomings, there are so many. The automatic denials, it's brutal. It's, in any other industry, having to fight to receive the services you pay for would be fraud. But somehow we've accepted that in the healthcare system. And so that, to me, is a huge shortcoming. Additionally,
what do you mean by automatic denials?
So, for example, Charlie didn't eat solid food when most kids do. She needed formula, but was too old for infant formula. She needed higher calories and different nutrients and stuff that an infant needs. And they make it, and it's called medical food. And so the doctor wrote the order for it, and insurance denied it. And I was blown away because I needed to feed my kid. Mm-hmm. So I looked into my policy and combed through it, and I saw there was coverage under durable medical equipment. If it's more than 80% of her nutritional intake, then it's covered, which in our case it was. So I called my insurer and asked, why isn't this covered? And they told me, oh, well, it's covered in your drug plan. So I called the drug plan, and they talked to me like I had lost my mind. They were like, no, why would we cover this? It's not even prescription. And so then I called insurance again, and they told me that they didn't cover it under my policy. So then I had to read them the part of my policy where it was covered, like physically pulled it out and read to them. And they were like, oh, well, you're right. I guess it is covered. So then they started, processing it and asked for a letter of medical necessity. And Charlie's gastroenterologist is amazing and very thorough. So he wrote a great letter of medical necessity. It wasn't like Charlie needs this, the end. It was, it was pretty detailed. Mm-hmm. So we submitted the claim, denied again. And so I asked, why was this denied? And they said it wasn't detailed enough. So I had to get the doctor to write a second one. And again, it was denied, even though it had more detail. So finally, he wrote a third one, and I actually included it in my written testimony to the Ways and Means Committee, his letter. And it's a page and a half long and very thorough about Charlie's conditions. And attached to it, he sent her medical records. And he also threatened to do surgery to put in more expensive nutrition intake if this wasn't covered. And so then they finally covered it. The whole process took over 2 months, and each day that she needed formula, it cost $27 a day.
Wow.
And I did not get reimbursed for that. It was just standard practice of having to contest. So
I think that the one thing that raises a great point is how the current, let's say, like the bureaucracy of the current private and often it's like kind of profit-driven healthcare system is a tax on people's time.
Oh yeah, I'm not paid for any of that. Whereas the people, working for the insurance company wasting my time are paid quite well, And the doctor, he could be doing better things than writing letters of medical necessity for something that should obviously be covered,
Exactly, because it takes away kind of doctors and nurses and kind of people in practice from providing care when they have to deal with all of the paperwork involved with insurance, and it takes away people from literally doing anything better that they could be doing with their lives when they have to deal with all of the paperwork and the interminable phone calls and the other kind of burdensome nature that we have in the system that we currently have.
Oh, absolutely. And another shortcoming was with Medicaid. I mean, I think it's great they expanded it, but it only goes so far. In Virginia, where we were living at the time, applying for a Medicaid waiver for a child like Charlie, who obviously needed it, was incredibly difficult. I had to fight like crazy to get her waiver. And in Virginia, kids with disabilities, that's how they get their services, is through a Medicaid waiver. And so I had to fight incredibly hard for that. And then when she finally got it, there was a 10-year waiting list for the waiver she qualified for. So she had to get a lesser waiver, like a waiver that had lesser coverage on it. And that, added to our out-of-pocket expenses. And eventually, they ended up changing the Medicaid waiver system to where it became priority-based. Sicker kids got bumped up on the waiting list, which meant Charlie would never get the Medicaid waiver she was entitled to.
Wow.
So, yeah.
And I think that highlights, again, one kind of a problem with the system is how, like, Medicaid is an important program and it needs to be protected, but when you means test programs and you put any of the various restrictions on who's sick enough to qualify or who has low enough income to qualify, it ends up with making people who do desperately need such benefits not able to, and it puts the burden on the person who's often either sick or low income, as opposed to treating it as something as of right.
And it's not only the means testing, but if it's not funded adequately, it leaves a lot of people out. So yeah, that we are the perfect storm of policy failure. And of course, I wish in the ACA they had included dental and vision coverage in medical insurance. That would have saved my face.
And I think that's an excellent point, because one of the strange natures of how the U.S. healthcare system developed over time is that we treat dental insurance as something different from regular health insurance, as though your teeth aren't a part of your body.
Right. And additionally, they talk about cost controls and wanting to save money. It would have been so much cheaper to just do a root canal and a crown than what happened to me. I went to the ER, so there's that expense. And even now, I'm having reconstructive surgery so I can eat again. And that is costing, I think the last time I went, the treatment plan is at $10,000 out of pocket, and I have dental insurance. And so I also, during the ACA fight, when I spoke with Republicans and conservatives, I say, you guys talk about wanting to save money, and here's Charlie. She has more than likely, if she gets the services she needs, she's going to be a typical adult. If you cut ACA and I can't afford to get her formula anymore, she's not going to die, but she won't thrive. She'll, have failure to thrive, which means she'll struggle more with all of her other issues, which means she's going to be dependent on the system her entire life. And it's unnecessary. So, yeah, there's just...
It's also kind of when you have a kind of a system, when the system in the U.S. kind of makes the main goal kind of making money, the preventive care, which is actually the stuff that can actually save a lot of money in the long term, as opposed to, say, short-term profit, ends up falling by the wayside.
Yeah, absolutely.
And then one thing else is that I would say that in terms of the U.S. system is that you often hear about, let's say, competition, right? So one thing that came out of the Affordable Care Act, you have the healthcare marketplaces where you can have different competing plans. And the one thing I always wonder is, like, have you ever met somebody who likes shopping for health insurance plans?
Never in my life. The only people I've met who actually like their insurance are people who've never been sick. Like maybe at the most they get a cold. And then, the $20 copay for their primary care is not a big deal. But as soon as somebody gets something that's chronic or just even big, catastrophic, then they realize very quickly how there's no such thing as good insurance.
Mm-hmm. And that's the thing that, like, there's often a conflation of insurance and care. So people might like the services that their insurance enables them to receive, but that's not like they don't have a deep abiding love for Aetna or Blue Cross Blue Shield.
Right. Nobody does. And in
I
fact,
write the holiday cards.
That's funny. I should too.
Just kidding.
But what was I going to say? Oh yeah. So when my daughter was insured through her dad's employer at the time, it changed just about every year, depending on whichever insurance cut the employer a better deal. Mm-hmm. And so when they say people like their insurance, it changes every year. Then you get to keep your insurance. Hardly anybody keeps their insurance for over more than maybe a few years at the most.
And I think what we're seeing right now is like an especially problematic element of the way in which you rarely get to keep your insurance. That when we've seen, let's say, like 22 million people, I think it is, who filed for unemployment claims over the past few weeks, many of those people lost their insurance.
9.2 million is the suspected number. I just saw it on NBC News before we logged on and started talking. 9.2 million people lost their coverage.
Yeah. In which, like, especially in a time like this, is just exacerbating all of the issues in a pandemic.
I know.
And so tell me a little bit about what are the problems with having a health insurance system that's so heavily reliant on kind of employer-based provision?
Well, I think one of the things we're seeing now is 9.2 million people are losing their health insurance coverage just because of the pandemic and shutting down their jobs or losing their jobs or being furloughed or whatever the choice of words is. There's that. But then also I feel like a lot of people would rather be in other jobs or would like to independently try something on their own, maybe start their own business or even move somewhere else and work in the same industry, but don't because they're afraid of losing healthcare coverage. So that is another issue at hand. Additionally, labor unions, when they could be spending their time arguing for higher pay, better safety measures instead of arguing for healthcare.
Yeah, exactly. And that's one thing. And I know that the Sarah Nelson, the head of the flight attendants union, has often spoken quite eloquently about that. It's like they'd like to be able to bargain for all of the other things that they're bargaining for wages and salaries, for workplace conditions, etc., rather than the air that having to talk about the healthcare provision ends up taking up.
Yeah, exactly. I mean, even me, I do what I do because this is my fight. This is what I've chosen. Mm-hmm. And if we had healthcare, I would be a park ranger. Like nobody should know who I am. I shouldn't know half of Congress. I should still be a park ranger in Virginia, just completely minding my own business. It's absurd that it's come to this.
And then one thing else in terms of like talking about, let's say, issues with the current system. I remember that there was an article a number of years ago looking at kind of what happened after Massachusetts passed its law. And although Massachusetts has gone like insurance rates near universally, medical bankruptcy did not go away and became a pretty significant issue.
Yeah, so medical bankruptcy is something that we considered when Charlie was younger. And when we spoke with lawyers, they told us not to declare until it's over because it would just keep coming at us. So we would declare, and then whatever time period would pass before you could declare again, then they'd end up just simply recommending that we declare again. So that wasn't even an option for somebody like us because it would just keep coming. In fact, the doctors told us that while we were still happily married, that the best thing we could do would be get divorced.
Oh, wow.
Yeah, that's
Oh, is it kind of like the way in which certain programs are designed for, like, to benefit
the
single
means testing. Yeah, exactly.
which
Although
is
I'm a single
very
parent.
in the system where you actually like are saying that if couples break up, it's actually they can actually like better survive.
Yeah, but I'm a single parent now, and it is tough. It is
Yeah.
not easy. It is brutal, actually. So I don't know how good or how sound that advice was, but
And there's one thing as well that you've hinted at with some of your when talking about how even when you are insured, there are still massive costs that you incur. I think that raises the good point of the insurance that underinsurance is still a major issue. And so being insured doesn't mean you always have good insurance.
right. I'm underinsured. I think in January I spent over, trying to remember because I tweeted out about it because I was so mad, but I spent over $300 out of pocket on healthcare and I had insurance. In February, I think it was maybe more, around 400. So, and my out of pocket max is, well, I don't have the insurance anymore because I'm on furlough now, but my out of pocket max, it was around 2,000 to 3,000, which meant I would keep paying like that for about 6 months until it kicked in, which to me is absurd. Like, what is the point of insurance if I'm going to pay $2,000? And the kicker is my daughter is on her dad's insurance, so I had 2 out of pocket maxes to hit. So yeah, it's just absurd.
And so, like, we've been talking about why the current system is so messed up. And so, as you noted before, that Mass Care advocates for single payer. What would a single payer system look like?
Oh my goodness. Okay, so single payer everybody would be covered, nobody out. Actually, that's one of the sayings: everyone in, nobody out. And it would include dental and vision. And instead of handing your money over to Aetna or Cigna or whomever, it would just be taken out of your paycheck, as Social Security is, and it would be much less. And the way it's paid for depends on what bill we're talking about. The national bill is different than the ones in front of Massachusetts. And what else do you want to know?
No, and so like tell me a little bit about when you're talking about how do the national bill and the Massachusetts bill differ from each other?
So, okay. Wow, you're really drilling me here.
We'll make a quiz after it.
After these breaks. Okay, so if I understand this correctly, I could be wrong on this. The Massachusetts bill sets up a trust, and it's a payroll. It's taken out with payroll, whereas the national bill is more like Social Security is, and paid for that way.
Okay.
I don't know. I'm not sure if that made any sense, but I'm trying to think of how to explain it better.
And then on the issue of cost, I'll say from like the exact specificity of how things get paid for, but I think it raises the point of we can afford this.
Absolutely. It would end up saving us money in the long run, because having one payer, they could bargain with pharmaceuticals, with hospital systems, and say, this is what they're paying in Europe. This is a fair cost. We're not paying more than this. And they can't do anything about it. They can't say, well, we're going to Cigna because Cigna will pay a little bit more and you're now out of network, or you're not in our network anymore, So.
And that's a good point, because like in the current system, where we'll often see that like every hospital might be charging its different rate for the same procedure, and that you have like the bargaining around the kind of cost of procedures, bargaining around cost of medicine, and that you have so many different people setting their own rates or bargaining over their rates, and then you lose out on the fact of like, no, this is the same thing. It should cost the same thing.
Right, exactly. And also when they tell you, oh, you can keep your insurance, which means you can keep your doctor. You could do that with Medicare for All. In fact, with Medicare for All, you're not limited to your network. You can go to any doctor and see, anybody, because everybody will take Medicare for All, unless they're concierge doctors that don't accept it and only take cash or something. But I think those probably exist in this system. I'm just not rich enough to know about it.
And then when we're talking about this, like, you kind of alluded at one point to talking about the kind of the prices that people might be paying in European countries. Tell us a little bit about, like, how does the U.S. healthcare system contrast with those that a number of European countries have? And like, what are the gold standard healthcare systems that?
Well, that's actually a matter of opinion because they all vary so much. You have some that are actually socialized medicine, like the NHS, where they own the hospitals and pay for it, and it's all government run. But then you have the hybrid system where it's single payer, but the hospitals are independent, and it just really varies country by country. And it's, I don't know if one system is better than the other. They're all universally covered. I suppose maybe once you achieve universal coverage, then it comes down to who's running the system. So I do think Medicare for All, the way the Sanders bill is written, or even the Massachusetts bill, is the way we're going to be able to achieve universal coverage in this country. Sure, the other plans or the other systems that are used around the world work for those countries, but the US is so different from other societies that this is the best option we have to implement universal coverage.
And I'd be curious, like, what are your thoughts on the ability for a state to implement Medicare for All at the state level? That it's something that, like, it isn't, because I know, like, in Canada, it started on the provincial level before it became a system. We have a really weird in many ways healthcare system, as we've been talking about. Like, could a state like Massachusetts decide we're going to do this on our state level and to put pressure on the national government?
Well,
like, how does that work?
That's how Romney Care happened. Yeah. You had basically the ACA here in Massachusetts. Everyone liked it. Everyone loved it. And so they were able to spread it nationwide. In Canada, they actually don't have a national plan. It's still provincial, but it did start with Saskatchewan had it. And everyone in Saskatchewan loved it. All the other provinces had envy. So they adopted single payer. So if we pass a Massachusetts bill, it's a very, very high probability it would go nationwide.
And I think one thing that, like, in terms of why Massachusetts should be thinking about stuff like this, it's something that I feel like gets left out of the discussion a lot, that there's a lot of existing public spending on healthcare. Like, that in terms of, and when you look at the types of public insurance systems that already exist, of, let's say, Medicaid, as we were talking about before, of Medicare, of TRICARE, of whatever the name of what, like, federal workers are on, that a lot of people already have public insurance. And as well as you have a lot of costs kind of are already built in, and you can actually just have a more efficient system if you have everybody in, as opposed to like a fragmented healthcare system that we have now.
Absolutely. And think about, the coverage that we could have if veterans didn't have to go directly to the VA. They could just go wherever. And like you were saying, you wouldn't have the fragmented system. And a system that is universal and covers everybody and is not means tested is more equitable.
Mm-hmm. And then, so what do you think are the biggest misconceptions that people have about Medicare for All?
Well, again, I'll lose my doctor. No, you can go see whoever you want. Then they also think that Medicare for All is the current Medicare. And so I have to emphasize that it's improved and expanded Medicare. It includes dental and vision and doesn't have co-pays or deductibles. In a very small bit, it does. If you get non-generic medication, then I think at most out of pocket a year you pay is $200. But that's the exception. Otherwise there's no copays, there's no deductibles. So I think people don't understand that and have been fed so much misinformation from pharma and that AHIP group that we have to counter a lot of that. And also people are afraid of change. So you kind of have to hold their hand and tell them it's going to be okay. This is better, but.
And then, so like thinking of the moment that we're in right now, how would having something like Medicare for all, that like truly robust universal system, how would that help a country in kind of dealing with a situation like a pandemic, both on the country level and to the individual level?
Well, there are a couple things it would help with. It would make healthcare more equitable. As of right now, we're seeing a lot of people of color being disproportionately affected by COVID. And it would address the discrepancies, or well, not all of them, but some of the discrepancies in that. It would also make Medicare or medical care more available. And by doing that, someone like me, if I get a cough, I would probably let it go a few days to find out if I needed to go see a doctor, if it was COVID, and that's 4 days of exposure to people, which, spreads it more. If I readily had access to medical care, I might think, oh my goodness, this could be COVID. I should go get this checked out. Better safe than sorry. And 4 less days of exposure to people. So, there's that. But then also there are shortcomings, social justice wise, that have created a lot of the problems we're having with the pandemic. Whereas low income people live in lousy housing and crowded conditions. And even if everybody has health care, that won't be fixed. Low income people are working what's considered essential worker jobs now. And, that exposes them to more risk. So there are things like that even Medicare for all won't fix, but they can get treatment. They could get treatment. And additionally, this brings up a thought in my head where they say, oh, well, the COVID is covered. You won't be hit with bills for that. But what if you don't get a COVID test? What if you can't get a COVID test? Then you still have to pay for treatment because it's not proven as COVID. So pay.
Yeah. And there have been cases, I think, of people who, just because of that inability to get tested, like it's likely that they died from it, but we don't know. Or that people think that they might have had it, and then maybe they eventually recover, but we just haven't had widespread enough testing that if you did have a more robust healthcare, like kind of federally run or even like state run healthcare system, you could ramp up testing on a far more efficient basis.
Yeah, absolutely.
Basis too.
Well, we would be more focused on getting the tests than rather paying for them. And also we wouldn't see like the entire basketball team being tested, whereas somebody dying of COVID can't get tested. And we wouldn't see as many of those discrepancies. So
definitely. And so I take that you're telling me that GoFundMe isn't a good method for a healthcare system.
Oh my goodness, no. We are the only country in the world where that is a thing. And we should be so ashamed of that it has even come to that people are begging on social media for their lives. Because of my mouth, I set up a GoFundMe, and it was a very huge moral debate in my head whether I should even do that or not, because I'm going to live. Granted, I can't eat and I'm in constant pain, but it's not a matter of life or death. And then, to set up a GoFundMe, then I'm competing with people who are begging to live. And is it right for me to do that and create competition for that? And yeah, so it was a huge moral dilemma. And finally I ended up talking myself into it because I'm tired of being hungry all the time. and just because the system is completely broken, it's not my fault.
Yeah.
And I had to, but still I feel incredibly guilty over the whole idea.
And I feel like what your point is a great point of the way that the healthcare system is designed makes people kind of almost, let's say, individualizes a lot of things about engaging with it. So like individualizes those feelings of like guilt for involvement in the healthcare system, or like having to evaluate, is my problem really so bad? And kind of having to make those constant calculations when it could just be treated as a right that you can go and get taken care of.
Yeah, exactly. When this happened to me and I had that, I thought I deserved it. Like, I just thought, and so it was a lot in my head to come to terms to realize that, no, what happened to me was a policy failure. And I tell people when I talk to them, 7 years ago, I never thought any of what happened to me could happen to me. I mean, we were living in Northern Virginia, buying a house, and we were the typical family. And it should scare the hell out of people that this happened to me, because it can just as easily happen to them. It was just bad luck on our part.
Yeah. And then one other point that you raised a little while ago that I think is an important one is about how, yes, let's say having a Medicare for all single payer system doesn't cure all of the ills of the system, but it's a clear improvement on the status quo, because there's never going to be a silver bullet, and nobody promises that. But let's say like dealing with a pandemic would be a lot better if you had that than it is without. And a number of the other issues that people might face are clearly better when you have this one thing that you have to worry about is already taken care of.
Yeah, and I had said earlier about how we're seeing people of color disproportionately affected by the COVID, and we see that a lot in maternal health, where people of color have poorer pregnancy outcomes than white people, and so we have all these disparities, and Medicare for All would address some of it, but there are other social justice issues as well. But if we get Medicare for all, then we can go after those.
It frees that, like with one thing that's true with a lot of progressive legislation is like people, like I would love my time to be freed up to focus on all the other things wrong with society. Right?
Medicare for all is my finish line. When we get that, I'm done. I will hand the torch off.
And so what can people do if somebody's watching this, or if they're not watching it but should be, and what are things that people can do to help advance this in Massachusetts?
Okay, so in Massachusetts, we were preparing to launch a non-binding ballot initiative where in people's representative districts, they could do a petition to get Medicare for All on the ballot. And by doing so, it would give backing to the representatives that already support it and say, look, yes, I'm making the right choice. My district wants this. And for those who are not on it, it would nudge them to get on the Medicare for All bill. So we were starting the beginning process of kicking off that campaign, but COVID happened. So now we're actually readdressing how we're going to do this and pull it off. We're looking at what elected officials are doing to get on the ballot and get their signatures, like all the creative ways they're coming up with it. And so we're looking to see which of those ideas work or don't work. So we're hoping to get a ballot initiative campaign launched soon. So look at the MassCare website for that. Also, something interesting is if you listen to the Medicare for All podcast put out by Healthcare Now, Ben Day and Stephanie Nakajima, they're amazing. I love them. But they talked about it in their podcast this week about how Bernie Sanders and Jayapal introduced a bill to get everybody who doesn't have coverage onto Medicare for the pandemic. And then Nancy Pelosi and the other Dems introduced a bill to which would extend COBRA, where if you lost your health insurance, then you could get on, the government would cover COBRA for you.
And for people who don't know what COBRA is, what is COBRA?
COBRA is basically you stay on your employer's health insurance, but you cover the entire cost. And it's actually quite frightening to see how much an entire policy costs when your employer is not subsidizing it. But so they would have that. But if you listen to the podcast, both Ben and Stephanie poke holes in that, in the fact that it is for people who are already privileged. You know, if you have a job that provides employer insurance and you qualify for COBRA, then it's a job in a company that has over 20 employees, because companies less than 20 employees don't qualify for COBRA. And if you're a private contractor, or if you have your own small business, you don't qualify for COBRA. So it leaves all these people out in the cold. So I think we're going to see a battle between the two bills and pushing the Jayapal and Sanders bill, because it is the most just and covers the most people, and hopefully leaves the fewest in the gap.
Yeah, and that reminds me, in terms of like responses that we're seeing, so I know that there's been a lot of I've seen bills filed on the national level to address the issue of, let's say, student debt right now, like whether it's like a moratorium or other things, given the fact that people have a lot less money coming in, they shouldn't have the same demand for paying accrued loans. Has there been any attention to addressing that same thing with like medical debt that people have accrued, of trying to get people, like the like bill collectors, to stop harassing people at least while they like might be sick with a deadly virus?
I'm actually not sure about that, but funny story, when medical bill collectors used to call me, I would actually talk back to them and say, what do you want? What are you going to take? You've already gotten my teeth. There's nothing else to get. And then they'd end up apologizing to me, saying, I'm sorry. So, and I wonder if there actually are medical collectors now calling. And not only is that in poor taste, but do they just sit at home and call and harass people?
Yeah, I don't even know how they have, if they do call centers.
Because call centers aren't happening.
Yeah, that's a good question. And what are some of the things, are there any interim steps that Massachusetts could take now? So like while we're fighting for Medicare for all, are there things that the legislature could do to just make our healthcare system more equitable?
That's a very good question. I'm not entirely sure about that. I do know that the plan I was on was one of the best in the exchanges, and it was not that great. Maybe reinforce the exchange, or somehow make better requirements of the plans in the exchange.
Yeah, it makes sense. And so if somebody wants to try to, what would you tell somebody whose legislator isn't yet a co-sponsor of Medicare, whether it's their congressperson's not yet on board, as several members of our delegation aren't, or their legislators aren't on board? What should they say to their legislators?
Just tell them your story and why you need it. Nothing is more powerful and sticks with a legislature than personal stories. Not necessarily your friend's story or your cousin's story or somebody you once heard about, but just go and tell them your story and why you need it, why you want it, why they need to get on board with this. Because I don't think a lot of these representatives understand. And if they do, then they really, really need to be pushed.
And I think that does get to an important point that, like, oftentimes legislators just don't have exposure to the range of life experiences that actually exist. So if they have had the privilege of being very comfortable, the fact that people might have unreliable insurance might not enter their mind.
Yeah, and it's something that's often talked about when talking about Medicare for all and all the other plans is let I want affordable healthcare. Affordable is thrown around a lot by policymakers, um, but I have to point out to them what's affordable to them isn't necessarily affordable to me, and
Mhm.
and that's a point I work hard to drive home, because people think, oh, a $40 specialist, and I go to a specialist every 3 or 4 months. Well, good for you, but if you need two specialists, three specialists, then it adds up. And yeah, and medications and so forth. So I had a friend on Capitol Hill that I talked to quite a bit during the ACA fight, and I was complaining about one cost or another to him. And because often when I was on Capitol Hill during healthcare fights, I would go without eating to save money. And so we were discussing something like that. And I was complaining about a healthcare cost, and he shook his head and he goes, "I know, with healthcare, when you get sick, you wonder, can I afford this?" And I looked at him and I said, "Look, I'm trying not to die. It's way past whether I could afford this or not. I just don't want to die." And it blew his mind that we had these two very different experiences with the healthcare system.
Hmm. Yeah, because as you know, like for many people, it's literally life or death, not just figuratively.
Yeah, absolutely. And I, yeah, it's just so hard to drive it home to how different our experiences are.
And so, what are the biggest obstacles would you say from getting it passed on the state or federal level?
Whew. On the state level, we need to get more of our legislators on board. We need to get them past this fear of Medicare for all, the fear of socialism, because that's used quite a bit when discussing it, and it's not at all socialized medicine. Um, in DC, it's more challenging, I think, again, because of that disconnect. And also, their ACA marketplace looks nothing like the marketplace in Massachusetts. So when you tell them, "Oh, my marketplace plan is not all that great," they're confused. What do you mean? You're just being picky, because their marketplace plans are amazing in comparison. So it's the challenge is not only getting them to view what it's like, um, but to realize around the country it's different. Or if you live in a rural healthcare system, it's getting healthcare is very different than DC. Additionally, there is so much money involved. So many of our representatives are taking money from healthcare profiteers that we have to get to the point to where they're in fear of losing their seat more than more than the comfort of that money they're taking it is in to push them over. Because money and power are the two things that seem to be motivators there. And so if we don't have the money, which none of us can compete with healthcare profiteers, then we've got to ramp up the people power and have them in fear of losing their seat.
So not to kind of, let's say, jump around, but one thing that kind of this discussion reminded me of that I had been thinking about earlier today is, as we're seeing, kind of, we were talking before about the high unemployment rates, that currently under our system, when like small businesses or business of any size have to also become healthcare administrators under our system. And when you have this like massive loss in revenue, et cetera, having to also be a healthcare administrator is not something that you as a business want to be doing, and can really help like exacerbate the recession that we have now, instead of and that Medicare for all would take that burden off, businesses, and be able to, as is the case in many other countries.
Yeah. So I've talked to people who spend months looking for the best plan for their company for the following year. And that's wasted productivity time. Um, Also, having to pay that. The businesses pay way more for coverage now than would be in the taxes and come out of paycheck deductions to Medicare for all.
Hmm. Which is the one thing that you often have, like companies have like a somewhat self-interest, thinking that they have a self-interested case against it, but it's actually kind of almost a universe. The only people who really lose out are like the CEOs of major healthcare companies.
And the insurance companies.
Yeah.
So it would be hospital CEOs, pharmaceutical CEOs, and the insurance companies completely. But in the Medicare for All bill that Jayapal introduced, there's retraining for people who work in the industry, so that even though they may be worried about careers, there's money for retraining, so they can seek different employment. Oh goodness, what else was I? I was going to say something else. I completely lost the train of thought.
No, but we can, I think, to go off your prior point that like how important it is for people to show up and to kind of like bother their legislators about something that really does impact people's everyday life.
Yeah, it saved the ACA.
Exactly.
And
Like for our last few minutes, you want to just tell a little bit about kind of some of the stories that you saw about like what was so effective about the advocacy around that?
So the advocacy around that was incredible because it wasn't your Capitol Hill regulars up there. It wasn't your lobbyists. It wasn't any of that. I met quite a few patients like myself, or like, I did some work with a little lobbyists who were just parents of kids with special needs who were looking at possibly losing their health care. It was people I'd never been involved in politics until 2017. So it was people who'd never been involved, just showing up. And not only showing up, but being relentless. I spent more time on Capitol Hill than I did in Charlottesville during those months. And we also, we lobbied, we rallied, we gave speeches, we did press conferences. And then when all of that looked like it was failing, we did civil disobedience. Before 2017, I had never had anything more than a traffic ticket. Then you have like soccer moms like me being arrested next to somebody who's in a wheelchair who's worried about their lives. And so you just have all of these groups coming together, and it was such a groundswell and so overwhelming that it was impossible to ignore. And so we need that kind of energy around healthcare again, and to push Medicare for all over the finish line.
Awesome. So I think I'm echoing, unfortunately, but but so to wrap up. So like one, I want to thank you so much for joining us. But so two final questions. One, what would your parting words to somebody listening be? And two, how can people learn more about the work that MassCare does and follow your advocacy?
Okay. So what was the first question?
Parting messages for those at home.
Parting messages, yes. Parting messages is get involved, because healthcare involves everybody. You can't sit on the sidelines for this one, because today it was me. I was the big loser in the healthcare system, but tomorrow it could be anybody out here watching this. And so it's much better to get involved and get Medicare for all to happen before there's another one of me made, because every day there are people who are dying because they don't have health care, and it's much better to not be me or somebody who dies. And so if it could happen to me, it can happen to you, is my parting thought. If people want to get involved in MassCare, you can go to masscare.org, which is our website, and we will update it as soon as we figure out the non-binding ballot initiative strategy and anything else we decide to do over the course of the year. And you can also follow MassCare on social media. There's a Twitter handle, and there's a Facebook page for it. So, and you can always reach out to me. I'm always yammering on social media. So
What's your Twitter handle?
WOODRA.
Sounds good. But I'll say thank you again so much for joining this evening, Rebecca. And thanks you for all the amazing work that MassCare does in trying to make sure that we finally start treating healthcare like the right that it should be. And thank you for the people who are listening now or will listen later, either on Facebook or when I upload this to YouTube later.
Oh, gee. Thank you.